Well, good afternoon. Many of you in this room know me, and you know me quite well. And probably what you know about me is I'm a behind-the-scenes kind of operator. I don't usually take the stage. I allow Andrew to do that. But there was something really special about Project Masiluleke. We've worked on it for almost 2 years, really, because that project was born 2 years ago in this room, the moment Zinni Tibete, who's joining me today, walked onto this stage and inspired all of us with her amazingly beautiful voice and her ability to overcome adversity with really, truly amazing dignity and grace. And that was the inspiration moment for Project Masiluleke. Our work on this project since that time has really provided a tremendous source of pride for PopTech. I think it demonstrates how a small organization, and we're pretty tiny in the realm of social innovation, can do it demonstrates what one can do when they rely on its greatest asset. And for us, that's the ability to convene doers and thinkers with a quest to make the world a much better place. Get my clicker here. So in the end, the story really does start with you. It's a story about this network, this community, and the coming together of all of our various assets that we bring to the table when we come to PopTech. And because of that, I think you should all feel a great sense of pride as you listen to the story unfold today. What we found a couple of years ago, or a few years ago, is there was this incredible bubbling of energy in this community. And a month or a year or a week after PopTech, we would hear about all these amazing collaborations that were taking place that we didn't do much to inspire other than to hold PopTech. And we started to see these amazing projects bubbling up out of people coming together at this event. I want to walk you through just a couple of examples of those types of projects. There we go. The first one I want to walk through was really initiated at PopTech 2005 and represents a collaboration between Nema Magana, a young social entrepreneur who was attending PopTech as a fellow, and Cameron Sinclair, an architect and speaker at PopTech that year. Serendipitously over lunch, and as you know, we shake you all up and send you to all different places, so you have to talk to people you don't know. Nema ended up sitting across from Cameron, and she shared this dream she had of creating a healthcare center in the village of Apuli in rural Tanzania, because there was a dramatic need to have some levels of health care and an educational facility in the area, because people had to travel many, many miles and long distances for those services. That dream became a reality with the help of Cameron and the help of another PopTech participant, the engineering firm of Haley and Aldrich. Cameron helped do design work. Haley and Aldrich put in-kind services around engineering expertise, and even raised money in their employee base to support the project. I'm really delighted to say that Nema's father, Charles Magana, is here with us today. He's sitting right in front of me, so he's giving me this good source of inspiration that I'll get through this talk. Charles is also the project leader of Apuli, and he's here in the States right now working on raising funds to continue the project. In 2006, we saw a little bit different collaboration, this one being very artistic, and it represented a collaboration between two PopTech performers that year, the R&B beatbox musician Reggie Watts and Young Chen Lamo, the Tibetan vocalist. Their collaboration resulted in the CD Anti-Babble, which is amazing. The proceeds from this went on to support Mahik, a nonprofit organization that presented their work here at PopTech the same year. So you start to see these interweaving circles. And in this case, the collaboration drills down further into the network. The album sleeve, which is absolutely gorgeous, was developed by Bob Hamilton and Kristen Hughes of Hamilton and Hughes. Longtime friends of PopTech, and they are here with us today. With the lights, I can't see you, so thank you for that. And seed funding was provided by Marka Hansen of The Gap to get this whole initiative off the ground. So again, a really fabulous example of PopTech network coming together. Last year, we saw almost instantaneously, this one took about 3 days or maybe even less, and I'm going to ask Kristen and Zinni to come up and help me with this one. Kristen and Zinni are part of iTeach. They're partners on Project Masiluleke. And this collaboration occurred between Kristen and Zinni and Sheila Kennedy of the Portable Light Project. Sheila was a speaker here last year and was very moved by Kristen and Zinni's stories of the problem of TB in South Africa, which is a major killer of people with HIV infection in that country. And what we knew is that many people living with TB live in housing that has no lights, and they're constantly cold because of weight loss and the disease process. So this blanket serves a couple purposes. First of all, it's solar powered. So the blanket provides warmth, and one can sit outside and get fresh air and ventilation, which is really helpful in terms of getting through the illness. And then you can plug in this little fiber lamp into a little cord. It's kind of like the Vanna White show up here, so bear with us for a second. And it plugs right in, and voila, it recharges via solar energy. And at night, when people need to take their medication, they have a light source so that they're taking the correct medications. So really amazing project. In order to capture all of this bubbling energy, as an organization, we decided that we had to do something somewhat formal to harness this. And that's where the PopTech Accelerator grew from. It was really a way for us to provide a framework to sustain all of this amazing collaborative potential that bubbles up every single year. And I think internally, obviously changing the world one collaboration at a time, we all have to start somewhere. So it's a starting point for us. But I think more importantly for PopTech as an organization, the accelerator has been a labor of love, and it's also represented the hard knocks department on occasion, and all rolled into one. I think it's a place where we've grown tremendously. We've learned the value of patience and listening. We've learned that it's okay to ask the dumb question, because the dumb question's probably the first one you ought to be asking. And we've really learned the importance of admitting a mistake and going back to the drawing board when necessary. The accelerator is an umbrella over 3 major activities at this time. You've all seen our fellows on the stage, and you hear about the fellows program through their voices. That was an initiative we launched this year, and we're incredibly proud of that program and of all the fellows in it. Andrew just talked about the digital hub today, and that is going to provide an amazing platform for collaboration on many different levels. And then the third is obviously looking at the implementation of highly focused and vetted projects over time. And Project Masiluleke is an excellent example of that. You're about to hear from my colleagues on this project the story of Project M. I think it's really represents an amazing collaboration exemplified by a world-class team of contributors, and their combined contributions to this project run into the millions of dollars. there we go. I'm going to put the partners right up there because they're a little bit out of order. The first I want to mention is Frog Design. They have really been critical to the success of this project, and that's embodied primarily in Robert Fabricant, but certainly an entire team. Just amazing support. Prekelt Foundation, Gustav Prekelt, there he is in the corner hiding, has really done dramatic work around putting together the technology we need. iTeach, representing HIV and TB treatment at its height. Nokia Siemens, an enabler of communications all around the world. National Geographic, documentation, and certainly a strong supporter of the accelerator. MTN, the second largest mobile provider in the African continent, major contributions. Aerocent, an IT and software organization that's provided a lot of technology advice. And Ghetto Rough Records, which is a record label in South Africa whose artists take on major social challenges and bring a voice to those types of efforts. In addition to these fabulous organizations, we also have a number of individuals that have provided philanthropic support to Project M, and we thank them from the bottom of our hearts. And there's 4 individuals I want to just quickly recognize, because without their vision and commitment, the progress we've made on Project M really would not have been possible. The first is Bill Gordon, who is a member of the PopTech board and a stalwart supporter of this project. He's gone to South Africa with us. He's attended 100 million meetings and is constantly on conference calls. Ava Holler, also a PopTech board member, a wonderful, fabulous role model for me, and I always consider her our leading Yenta in making the right connections for us as we do this work. Jason Rezepka, our communications director, who has immersed himself and spent the better part of the last 3 months helping us tell the story of this project as it unfolds. And last but not least, Beth Cohen, our vice president, but also an incredible filmmaker who has helped us document the project over the last 1.5 years or so. I want to ask all of you to follow the lead of these amazing organizations and the amazing individuals I've just mentioned. As you listen to the story of Project M and think about how you might be able to lend a hand and connect us to those who can, I hope you'll consider doing that, because the story will really continue with you. Thank you.
As Letha said, this story really began in 2006 when we first had the honor of welcoming Zinthe Tebete to PopTech, and over the course of just a few months got to know her and her extraordinary colleague and mentor, Dr. Krista Dong, who collectively run iTeach, an incredible organization and a kind of innovation laboratory in its own right for transforming HIV and TB care in incredibly resource-constrained settings. And so we thought it was really important to ground this conversation so that all of you who are new to the conversation can hear the context by welcoming Zinthe back. Zinthe, would you come on up and give us a sense of the context of Project M? Thank you.
I would start by saying I am really, truly happy to be back. Just to see the people and to be in the presence of the wonderful people of PopTech. But most importantly, because in my heart, I feel this is what I have been waiting for. It is amazing to see that it is happening. And I will just take you through, just because I want to set a ground where the Project M team will be talking from in terms of what is the crisis that pushed us to engage in Project M work. South Africa is the epicenter of the global HIV pandemic, the largest burden of HIV-positive people. 5 million people who live in South Africa are HIV infected. And KwaZulu-Natal is the ground zero of the South African HIV epidemic with the highest rates and numbers of infected people. And KwaZulu-Natal is actually my home, and this is why it is particularly important to me and very dear to my heart to have this work done in KZN. There are challenges in South Africa that feeds into this HIV crisis. We have challenges like poverty, high unemployment rates, overburdened public health care systems, HR crisis, not enough doctors, we have not enough nurses, overcrowded facilities which breeds into increasing TB infections, lack of government support. But what makes it even worse is this kind of media that we have been having covering HIV issues. In South Africa, it's not that we do not have information that will move people from taking action, but we do have the information that is in billboards, but in wrong language, that is offensive to the people, that is bringing negativity to the HIV crisis. And in this story, we actually took time to go and talk to people, those who managed to test, to find out what made them test, just to try to figure out, is it because we don't understand or there was another issue? We figured that 100% of those people were never moved by a billboard, were never moved by a story that was told in media, because all of them were negative and they were all representing death. And we have never seen anything positive about HIV crisis in South Africa. So nothing worked for people to make them change their behavior in South Africa. Furthermore, what makes it even worse is that we have billboards that supports behaviors that are unacceptable, like you have to take a shower after you've had an unprotected sex with somebody with HIV. That is even ridiculous. And if you're thinking about it, that is coming from somebody that we would be looking at as a father and a dad who tells the children, once you've had HIV sex with somebody who's infected, it is okay to take a shower. So we've got HIV testing in South Africa, which is widely available, but 5% of South Africans have been able to test to date. What happens is that the norm is that people are only coming to healthcare only if there is a crisis, an incident, and usually it is when people are dying. ARVs, which is antiretroviral treatment, is available for free. And you would think in that setting, people will be open to come up and get help and try to move on with their lives. But something is not working right there. Most patients in the wards die from AIDS-related illnesses, untested and also untreated. Those that we managed to get into treatment, 40% of those on antiretroviral treatment will die anyway because they present very late. And why is this? 95% without knowing their status in South Africa will die without life-saving drugs. The question is why? What is the issue in South Africa? These are the things that are a problem. Stigma is still huge, it's still powerful. People don't like to talk about HIV. People are not comfortable having any dialogue or any conversation which has to involve HIV in South Africa. We haven't been able to reach men or women, and we know that women do come forward for healthcare, and they do come forward for testing, but also it is because they are forced by circumstances like they have to protect their babies, things like those. Men, we haven't been able to reach them that much, as well as young people. The other thing that is even amazing is that men would rather come to the clinic when they are looking that ill, when they've lost humanity, when they've lost dignity. That's the only time you will find male people participating or even having a dialogue or even coming forward for care. The question to me that has been in some of my shelves that I hide, because I like to represent hope and I like to represent things that are possible and that it is actually possible to live with HIV. But the question has always been in me that, is it possible that we can make a change? Is it possible that we can have information in South Africa that can change behavior? Is it possible that we can have information that will touch people, that will move people into changing their behavior? Is it possible that we can start people on treatment early and prevent unnecessary deaths that are due to HIV? Is it possible that in the epicenter of the global AIDS crisis, we can start life-saving treatment, support those who are on treatment already, and remain healthy and productive in South Africa? Is it possible during this period where we are seeing a shift in South Africa in the political will and in the government will that we can change things? I am so happy to have my team talking about the possibilities through Project M.
Let me now introduce with that question. And Gustav, before you stop, let's just take 10 seconds of quietness, just for a second. And just think about what we just heard, okay? From a place of fully absorbing and sitting quietly with that kind of information, with those kinds of statistics, and with someone like Zinni, we knew that if there was any place we were going to foster collaboration in our network, this was the place to do it. And almost immediately on our journey, we came upon this extraordinary man who you're going to meet now, Gustav Prekelt, who has dedicated his life to understanding how this mobile technology, how mobile tools in the hands of everyone can actually really affect and have real impact, not hypothetical, not piloted, but real impact. So now it is my great pleasure to introduce Gustav Prekelt from the Prekelt Foundation.
Good day, and thank you for the opportunity to speak to you today. I think the first thing to understand is what is our first hurdle, what is the biggest hurdle that we need to overcome, and that is to get people tested. We have only 5% of South Africans currently being tested for HIV, yet we have a great HIV testing program. It doesn't cost any money to get tested in South Africa. You can go for free, and people know it's a life-threatening disease, yet nobody is going to get tested. So how can we use mobile phones, and how can you use this incredible penetration of mobile phones to address the problem? So I'd like to give you a little bit of a background around mobile phones in South Africa and Africa. As you might know, mobile phones are, Africa is the fastest growing mobile region in the world. We have 1 billion people, of them 300 million phones in Africa. South Africa is really the perfect place to do a pilot like Project M. We have 48 million people, 43 million phones in South Africa, and almost all of these phones have come into the country the last 10 years. And really what that means is we've got a phone in almost every household in South Africa. However, mobile phone usage is different in Africa than in developed countries. We've got roughly 95% of people that are on prepaid, which means you can run out of airtime. If you're halfway through the month, you're not on contract. And if you're out of airtime, interesting behavior starts happening. You can't give somebody a missed call to let them call you back if you don't have any airtime left. So this technology was developed about 10 years ago in South Africa called the Please Call Me, where you dial *121#, and then the cell phone number of the person that you want to call you back. Now, the amazing thing about this, it works if you have absolutely no airtime on your phone. And the interesting behavior that occurred, as you can see there, we send roughly 30 million Please Call Me's per day in South Africa, and we only have 48 million people. That's roughly 1 for every 1.5 people. And the interesting thing about it, because it works when you have absolutely no airtime, people start using Please Call Me for all sorts of other reasons. You might be sending the Please Call Me to have as an overt call to get somebody to call you back. You might have a prearranged signal, I'm going shopping, and Mom, could you please come and pick me up? And finally, people use them. They kind of go at night through their phone book and send please call me to all their buddies, just as a kind of presence to tell them that they're still around. So people don't really necessarily just use them to get people to call them back. And also, interesting enough, I think we'd probably be sending 100 million please call me's every day if it wasn't for the fact that the networks actually stop you from sending more than 6 per day. So there you can see that's how it looks. Please call me, and my cell phone number because I'm out of airtime. But what's interesting, this is an SMS that gets sent to the person that you want to call you back, and the SMS has got a lot more space. So our innovation really was to insert a message in vernacular or in English into the other 120 characters that are left for us. And that gives us an incredible opportunity to drive social change because it's a different demographic that uses this type of technology. It's people that usually run out of airtime. So now for the first time, it's possible to do a mass medium interactive message to that audience. And we can have different calls to action. In this case, you can see we asking there in Zulu whether if you're HIV positive to please call, and if you want more information to call the AIDS helpline. We can also ask people to SMS us. If the call center is overburdened, they can call at a later stage. And then finally, you can put a WAP link in there and people can find out more information. So we started doing this last year before we met the people from PopTech. We had a number of interesting pilots, some really specific problems that we tried to address there. We had a pilot where we had kids who needed cleft palate surgery, and we managed to qualify in only 5 days. We had 450 leads, and we qualified 42 children for free surgery. We also did some commercial trials, kind of bottom of the pyramid, commercial trials with Unilever, where we managed to get 500,000 entries, 200,000 uniques in only a month. Now you have to remember, these are people that you ordinarily just wouldn't be marketed to. Right? They don't have spare income, they can't spend money, so why bother? Yet we managed to get 200,000 of them to give us an SMS in 1 month period. And then as a precursor to this project, we had a trial where we sent please call me's and asked people if they wanted HIV information to call the National AIDS Helpline, and we doubled the traffic in that 1 month period. So, on to Project M. We were lucky enough to launch on the 1st of October, 3 weeks ago. We're really in the opening stages. There's our first message. Please call me, 082-459-3656. Are you HIV positive and being mistreated by a family or friends? For confidential counseling, please call the AIDS Helpline on this number. And the response has been amazing. I must add here, MTN, the largest operator in Africa, has given us 5% of all the inventory. So we are sending 1 million of these messages out every day, and we are generating huge response from that audience. The messages, again, I teach, were doing lots of research and focus groups to get the right messages out. We need to have these things vernacular. One of the interesting things that came out of our pilots, we found Zulu and Sotho actually gave us double the response time, yields that English gave us. So it's really incredibly important to have those accurate messages. So some of the results, we sending about 1 million a day out. We have been tripling the traffic into the National AIDS Helpline from 1,000 to 4,000 calls per day. We haven't even started incentivizing, which we know will probably crash the call center. We hope to generate 1.5 million calls in the first 12 months of this project. Now, if you compare that to the number of people that have been tested in South Africa, you can see that we can really go to scale. Okay, so what next? We'd love to expand it across the rest of Africa. Please call me's are hugely popular everywhere else in Africa. Call centers. If we start incentivizing, we need more call center operators. We need better call centers. We need call centers that can respond in vernacular. We want to move from providing just information to have a direct link into getting people tested so that we can connect our message to whether that person actually went to a counseling and testing center. And then finally, we've been piloting another project, which I'll show you a little slide about, where we really want to provide adherence support for patients who finally actually went for testing and went into the ARV or antiretroviral treatment program. And there you can see the screenshot. We've been piloting with 10,000 patients at one of the largest HIV clinics in South Africa, where we send SMSs to people who are in treatment. You can see that it says, you have an appointment at the clinic on the 1st of November. Please call us if you want to change your appointment. And that way we can really track the performance of the campaign long run. And I'd like to hand over to Robert to take us through this program. Thank you.
So what you have just heard is about how people working deeply nestled, deep in the community most affected by this illness, working with technologists working on the very vanguard edge of technology, working together can create technology solutions that reach millions of people and really go to scale. And we are already on a daily basis, just every email that comes out of South Africa about the data that we are seeing how this project is amazing. But as a through line through the project, even before we alighted upon this solution, we at PopTech were incredibly honored by the commitment of an organization called Frog Design. Frog is one of the world's preeminent design firms and strategic design firms. And what I think is interesting about design, and you've heard about it here a couple of times actually in the last few days, is this idea that design is more than putting the finishing touches on a piece of consumer electronics, or about designing the bevel on the button of your digital music player. But that design is a process of thinking and a way of doing strategic and creative problem solving. And what Robert and his team brought to Project M is a way of thinking to discover new problems to solve and ways of taking the incredible results we're already seeing out of Project M and treat them as the baseline for a platform for an incredible breakthrough solution that's coming next. And so I am incredibly honored that Robert and his team, they have put hundreds of thousands of dollars and hours and time and their incredible patience and commitment and resources behind this. And I think what you're going to see now, on top of that already incredible result, is really astounding. So you please welcome Robert Fabricant.
Hi. So I wanted to start on a personal note. So obviously, for me, coming back here this year after launching this project 1 year ago, it's been a moment to reflect on what an incredible experience it has been. And it's been an incredible experience not just for the reasons you've already heard, which is the opportunity to have an impact on a situation as dire as this, on the scale that I believe we are going to have an impact. But it has been an incredible honor to work with the specific individuals on this project. I have to say they're some of the most talented people I've ever worked with, and there's not a single social problem that I can imagine taking on with a finer team than this. So first of all, obviously Zinni and Krista at iTeach, Gustav and Robin at Prakelt, Letha and Andrew at PopTech. They really have been incredibly talented and dedicated and astonishing partners throughout this process. I also wanted to say, as Andrew mentioned, that there's a Frog team both in the room and online. And I'm really representing their ideas, their thoughts, their beliefs, their values, and their dedication to this project has been awesome as well. So again, my gratitude to the commitment I got from my organization and their involvement has been an amazing experience. I have really two goals today. First is to give you a little rewind. How did we get here? And then talk about where we're going. So I'd like to see a show of hands. How many people were in the room last year when we launched this project? All right, so I'm going to pull up an old cartoon, and it'll probably be make a little more sense to people who are here, who were here and at the moment of that launch. So it says, "Stop digging. The plans were upside down." And if you were here, you'll understand why I wanted to start with this note. So we got involved a year ago, and there was a very, very specific solution that had been identified. The problem was the solution didn't really fit the problem. And this really goes back to the purpose of design. So design is not just about coming up with the solution. It's figuring out the right way to look at the problem. So we left PopTech a year ago. 2 weeks later, we were in the Frog studio with Andrew, Zinni, and Krista. And it was an incredible moment of fear and panic. Because, as you can imagine, particularly for someone like Andrew and me, going into a situation like this, trying to impact a crisis on this scale, it was very important to feel like we had a secret weapon. But and in fact, we did have a secret weapon. It just wasn't what we thought it was. It wasn't a piece of software. It was a design process. And it's hard to imagine that design process in 1 year is going to get you to the kind of solution to this kind of problem that you hope for. And it's a huge leap of faith. And that's a leap of faith we all took. And so really, the Frog team came in initially to really help guide that process and help us identify a different approach to the problem and help us weave together the opportunities and solutions we found on the ground. And along the way, we applied a process that we use. I'm not going to go through the details of this process, but you can imagine we applied it a bit differently. As one example, we do a lot of research. A lot of our design work is driven very much by what we find on the ground. And we usually expect that we're going to find answers on the ground. And when we were in South Africa the first time, we didn't find answers. Answers, at least, that were unique to anybody who knows the situation. But what we did learn was how to ask the questions. And it started a period of collaboration where we understood how to ask the questions and how we could work together on solutions remotely to come up with a strategy that I think has incredible potential. So this is just a roll-up of the statistics you've been hearing. So this gives you a sense of the scale. This is only for the province of KwaZulu-Natal. So 10 million people, and down at the end of the funnel, 200,000 in treatment. Sorry. We were here a year ago. And the first thing we did in the design process is we turned the plans upside down. And we decided, as long as we're starting from scratch, let's look at how we can affect the broadest population, because that's going to make the biggest difference at every stage of this process. And you've heard about the first phase. So this has really been about addressing that huge end of the funnel and driving mobile awareness and solutions and getting information to people so that we can begin to motivate them. But the big question now is, what do you do once you've motivated people? How do you use that to deliver the positive outcomes that we need? And so we looked at a whole host of solutions and started to look at how we could fit them together. So how could we not only drive awareness, but begin to improve the level of service at the call centers, provide a testing solution, which I'm going to go into great detail, and then support adherence. And I'm going to really get, we've done detailed design work in each of these areas. I'm going to take the example that I think has the most potential and is really the most immediate kind of next phase of this work, and it's really talking about self-testing and home testing. And I want to start by saying we had some questions about self-testing. It's not an easy topic to grapple with. And we got a very strong, very clear message from Krista and Zinni that they felt it was critical. It's a critical piece of the puzzle. And from being on the ground, we understood if you have 4 million people who are HIV positive and a few thousand nurses, the question is not whether home testing is the right solution. The question is, how do you make home testing work? And that's a design problem. And it's a very powerful and meaningful design problem. So here's the evidence. There are self-testing solutions on the ground. They're expensive. They're hard to find. This picture on the top is a picture that Krista sent me from a hospital in Edendale. And this is the man who can get you a test kit. In order to get it, it's locked in a storage room. But that's not the end of the story. In order to get it, he has to get the key to the office. And he has to go into the office, and in the office is a key to the desk. He has to get the key to the desk and open the desk drawer. In the desk drawer is the key to the storage room. Then he has to walk across the hospital to the storage room and unlock the storage room to get to the test. And the reason for this is that these things are flying out off the shelves in the hospital. Health workers are stealing them routinely so that they can test themselves and their family members. But none of these products has really been designed as a service, as an experience. It's a piece of technology. It's a mechanical tool that, as you can see in the bottom, is available, but is not a help. It's not a supporting experience. So that's what we wanted to do. We wanted to take what was just a pure piece of technology and turn it into the kind of experience that would really work on the ground for the people in that community. And so, working again with Zinni and Krista, we organized a series of focus groups and collaborated on developing the right questions to begin to learn about how people might make people accept a solution like this. And along the way, we came up with a very clear starting point, which is that the focus of this project is about men. Men are much less likely to test. You saw that in Zinni's remarks. They're largely absent from the system, and they were hugely responsive to the idea of a self-test kit, something that they could have control over, they could do on their own, and feel a sense of privacy and respect. That's what they're missing in the clinics. So 85% of them said they're less likely to go in and test. 78% said they would love to use a test like this. So this was a very important starting point for the design, because now we had not just a design problem, but a core audience, a core idea of who we were serving. And out of that came some themes that really ground the work we did. The first theme was global local. We wanted to develop a solution that was not specific to South Africa, that could be applied anywhere. Not specific to HIV, could be applied to other diseases, but at the same time felt local to the people who were using it, identified with their sense of local pride. Second, we wanted it to be a bridge. It's not just a test that you do once, get a result, and you're done. It's a starting point for getting involved in the system, getting services, and improving and raising your awareness. And we really felt it was critical that people understand that you don't just test once and stop, but that it become part of a cycle of behavior. And the last was, we knew people were going to do this privately, and that's what they wanted, but we didn't want them to feel alone throughout the process. And that became key, and we started to tell that story around a character. This is a standard approach to design, coming up with a way of embodying the experience, the ideal experience. And this was Beaky. He was 19. And we started looking at each stage of the process, what he would be looking for, how to make this experience work. And again, it wasn't just about the material of the test. It wasn't just about the way the test worked. It was about how we were going to support that experience. And we translated that. I know it's a complicated diagram. I'm going to break down each of these layers in the next few slides. But we translated it into how we were going to balance those needs across physical components, across data services like Please Call Me's, and across human interaction through call centers, et cetera. And we started to look at, for this particular example, the flow of information, because we needed to bring all these things together. And so here's the starting point of the experience. We wanted to create a product that looked simple, that had a positive feeling, that gave an immediate message of support and optimism, and something that you could easily see, that you could carry with you, slip in your pocket. It would be something you could easily take out and use when you were ready. Already, we wanted to make sure that there was a call to action, that there was supporting information right on the surface. So in this case, for example, you've got a number, and you send a Please Call Me to that number. It'll deliver a 60-second voicemail into your inbox that gives you an expression of pride from someone in the local community, somebody who's a figure within South Africa, explaining why this is so important. So voicemail is a very powerful channel that is so underutilized. We have a semi-literate population. We have 60 seconds of audio that they can access freely. So how can we start this process with a strong message? How can we give someone who didn't even walk away with the kit necessarily a chance to get some encouragement and to think about and feel confident in approaching this experience on their own? This is how the kit opens up. So very thoughtful around the interaction design. You pull those caps off, and what unfolds are the instructions. And really, all the kit contains are those instructions, the end caps, which are reused, and a simple off-the-shelf piece of testing technology. So this is a self-test kit, a saliva-based kit, not expensive. So we didn't want to make any requirements on the testing materials. Those are off the shelf. We created a simple package design. It reveals itself when you open it up. Every part's reused, and you have a simple set of instructions to follow. A pamphlet that you can walk away with if you're not ready to reach out for support. And everything else should be very simple and easy to interact with. So here it gives you just a little more detail. We wanted this to be extremely graphic and simple. Again, rely very little on written instructions. A simple walkthrough, and once again, connections throughout to mobile services to support the experience. Here's the other side. So this is that unfolding piece of cardboard. So on one side, you've got instructions. On the other side, not just a positive message, but cultural figures. And we'll talk about who these specific people are who are participating in the program a little later. So here's the English, for those of you who do not speak Zulu. Here's the pamphlet. Once again, we're talking to two audiences. We're talking to people who are positive and negative. and giving them a sense of how to follow through on the experience, how to get more information, and how to get support. Trying to connect for people and get them engaged in services regardless of their status. Again, if you couldn't read the Zulu, there's the English. Throughout this process, we've had a remarkable collaboration with iTeach. So we've had the chance to develop concepts on a weekly basis and send them down, and it was an amazing experience. You feel so awkward calling up or emailing Krista and Zinni and asking for their time, asking them on a weekly basis to organize 4 focus groups in different communities, both in the towns and out in the villages and in the rural areas. And very quickly, the Frog team was amazed, not just by how responsive they were, but the level of detail in their feedback. And it really created a strong sense of responsibility and obligation. If they're going to put given the value of their time, if they're going to put that kind of time into getting us feedback, we would work night and day to iterate and improve the solutions and reflect the feedback. And by the end, some of the stories we heard were incredible. People in these sessions would walk out after they'd seen and had the whole kit explained, and they would expect the kit to be available right there. They expected they were going to be given it. They wanted to test right away. They wanted to test right there. And they were very disappointed. They needed it right now. And I think, as you can see in these quotes, that time urgency is critical. And it's something that we all feel working on this project. It's an incredible sense of responsibility to try and get the solution into the market quickly. A couple other features of the design are, again, its modularity and simplicity. So we imagine that other than these off-the-shelf testing elements, you have end caps that can be made out of any material locally, and you have these pieces of cardboard. On one side are instructions. The community can print whatever else they want on the other side. So it's something that can be mass distributed, manufactured locally, and our vision is that communities will assemble these themselves so that they'll have a strong sense that they're able to support themselves, they're able to provide their own solution, and it's growing out of their community and out of South Africa and not being brought to them from the outside. So in my last few minutes, I wanted to connect back to the big picture of this conference, which is scarcity and abundance. We've been talking a lot about scarcity. That's what this whole story has been about. It's been about the lack of healthcare resources in the community and innovative ways to bridge that gap. We've heard for years now about how mobile technologies are bridging the gap with people, moving them beyond leapfrogging wired infrastructure to wireless infrastructure. And I think what you're seeing now, which is most remarkable, is that's just the starting point. And mobile technologies are creating a leapfrog effect in many other areas of life. So we talked about it earlier with Ken Banks and politics. We know it's happening with mobile banking, and we believe it's going to happen with healthcare. But it's also a story about abundance. So oddly enough, while I was working on this project, I was also working for one of the largest insurance companies in this country. And they have many resources. We spend more per capita on healthcare than any other country in the world. So you'd think the kinds of solutions that I'm talking about here would have very little relevance in this country. As some of you may know, insurance companies have their backs against the wall. And I know you're tempted to hiss when I talk about insurance companies, right? But they have their backs against the wall. 65% of the costs that they face are coming from a small percentage of their population who have acute and chronic illnesses. And so we were working with their disease management group, and the disease management group was really interested in finding ways to reach out to people earlier, to get them to connect and improve their behavior earlier in the continuum of care. That was their focus. They're looking at epidemics of obesity and diabetes, and they're trying to figure out how can we get to these people. They're not listening to us. Our current set of tools are not reaching them. Sound familiar? So what's missing here? How many of you have ever received an SMS from your doctor reminding you about an appointment? There we see a few. How many have ever received an SMS reminding you about a mammogram or some other test you needed to take? So here we are in a country of incredible wealth, and we're not anywhere further along in terms of thinking through these kinds of solutions. Here's just one example of what's starting to happen. We're seeing abundance and a lot of solutions starting to emerge that provide feedback loops around diabetes in America, and in the same time in Mali, they're using those same tools to try and address malnutrition in babies. This is happening all over the world. So on a small scale right now, but it's a phenomenal wave of innovation, all tied to such a simple and impoverished tool, text messaging. It's astonishing and counterintuitive to a designer that this would be the most powerful tool that we have in such an emotional situation. So it's happening all over the world, and it's addressing an extraordinarily broad range of issues, healthcare issues, from AIDS to osteoporosis. This quote really became by far the most significant influence on me in this project. So it comes from George Whitesides, who's a preeminent chemist at Harvard. And what he's saying here is that diagnosis is information. We think about it as technology. We think about it as science, but it's not. It's information. And if we can get that information out as broadly as possible at the lowest possible cost, then we will succeed. So we've tried to put forth a model for how to do that, a model that we think is the starting point for succeeding in that effort. It involves rapid improvements in off-the-shelf diagnostics, an approach to packaging design that integrates mobile services that's simple and ultra-low cost, local assembly and distribution so that it can be addressed and developed and part of the local community's response to crises, and by far the most important piece, integrated mobile services. So ways of connecting to feedback that is much more readily available than any other. So to come back to Zinni's message, is it possible? We created this visual as a way of putting out an aspiration for the future, that someday health officials, NGOs, people dealing with these kinds of health crises can go to one place, order a flexible set of diagnostic tools customized to their needs, activate a set of mobile services, and immediately begin to address these problems in real time. Thank you.
And I'd like Zinni to come up too. This is Dr. Krista Dong, who leads iTeach, and of course you already know Zinni. Some of you will know that Krista was here with us last year as well. I'd like to ask the two of them to talk about the kinds of endorsements we've had and who's gotten behind this project, both in the, well, why don't you just take it from there?
Hello, thank you, Andrew. The ability, the idea that it's possible to empower South Africans to manage their own HIV health risks, to reach individuals and communities that we've been unable to reach, is a dream of ours and what we've dedicated our lives to working toward. And up until Project Masiluleke was launched, we didn't know how to do that. An HIV self-test kit is something we think that is very long overdue. It's no longer a question for us whether we should do this or what are the complications that stand in our way, but how fast can we do this? When hundreds of thousands of persons are suffering and dying, it's our obligation to move forward when we have a solution that we can feel in our hands that we really believe will work. Robert talked to you about the focus groups, and we had lots and lots of focus groups, both in rural areas, in peri-urban areas, and urban areas. And it was uniform, that everybody wanted to test and wanted to test then and there. So our assumptions that South Africa was ready and that people would use this and they want this was confirmed over and over and over again on the ground. So we know we want to do this, but something that's a medical test is something you don't undertake lightly just because you're getting a groundswell of information from the community, which is critical. So we have engaged medical expert advice, both importantly on the ground in South Africa. A few of those individuals include Dr. Francois Venter, who is the president of the South African HIV Clinician Society, a renowned TB and HIV clinical research expert, Dr. Douglas Wilson, who is the editor and primary author of the South African HIV Handbook. Additionally, here in the United States, we have him with us here today, Dr. David Bangsberg from Harvard, who has dedicated his career to infectious disease, specifically HIV, in sub-Saharan Africa. So we have absolute experts that are advising us. But Sandile, a 19-year-old Zulu South African who lives in a township, really doesn't care about the credentials of Dr. David Bangsberg as much as we do. But there are voices that Sandile does care about, and we would like to share those voices with you.
Sure. Sanwa. Igama lami uMalike. Mina ngifuna ukusikhohle kancane nge-TB. Sike sijabule sicule nje sonke sibe mnandi. Everybody should know they can have a second chance in life. My name is Malik Zwane. We're from a record company called Ghetto Ralph. What we're gonna do, we're musicians, right? So we felt we can spread the message through our music, but we needed to see what is going on before we preach it to other people. So now, say what? Live your life.
I just felt, you know what? I need to go do this. This is what I'm supposed to do. Because I lost a sister through this thing.
So now, live your life.
I'm shocked because where I'm from, the stuff is not shown to me. We don't read about this kind of stuff.
Because like most of people, they die nowadays and they die without knowing what kills them. So it's important for people to test now. And I think it's from me, Fisto, as Gumshev. I'm also ready to check.
So now, live your life. So now, live your life. Let everybody go.
This is the reason why I'm happy. This is the reason why I feel we have managed to change and to shift the HIV crisis in South Africa. I feel very positive. I feel very hopeful.
And I'm even excited because 7 years ago, I was told that I wouldn't be living that long, but I'm excited that I've lived to see amazing change in the HIV crisis in my home country. What is even more exciting is that we're engaging South Africans, male people, young people. In this work, we have been able to engage even to the grandsons of our former president, Nelson Mandela, the children of legacies, the Sisulu's families. Children are ready. South Africa is gonna do what they have been supposed to do a long time ago. I am so happy, and I thank you very much for allowing me to realize a dream and to feel peaceful finally. Thank you, Andrew.